In disciplines like dance, gymnastics, and yoga, where flexibility is at the core of training, the technique of assisted waist compression, often referred to as sitting pressure on the lower back, is a commonly used and widely adopted method. By applying external force, this technique helps practitioners break through flexibility plateaus and expand their range of motion. However, despite its seemingly straightforward appearance, this practice demands a deep understanding of technique, timing, and physical feedback. When used correctly, assisted waist compression can accelerate flexibility gains. But if applied improperly, it poses a significant risk of muscle strain, ligament injuries, or even long-term chronic damage. Therefore, a proper understanding of its purpose, method, and safety precautions is critical. Assisted waist compression involves a trainer or coach applying downward pressure to a trainee's lower back, typically using their own body weight. The goal is to deepen the stretch, particularly in movements such as back bends or bridge poses that are commonly found in dance classes, yoga sessions, or gymnastics flexibility routines. Unlike active or self-directed stretches, this method involves passive stretching, where external force brings the body into a deeper stretch than it might otherwise achieve alone. This passive component is key to pushing the boundaries of flexibility, especially when a student has reached a plateau that voluntary efforts alone can't overcome. One of the main functions of assisted waist compression is to help enhance flexibility and surpass the physical limits that the practitioner might otherwise be constrained by. Especially when someone has already reached a relatively advanced level of mobility, and further improvement seems stagnant, targeted external pressure can guide joints and muscles into extended ranges, prompting the connected tissues, like ligaments and tendons, to adapt and stretch further. It's a way of nudging the body beyond its comfort zone, allowing for new movement potential. Another essential benefit is the stabilization of the body during deep stretches. Many beginners struggle with maintaining correct form due to weak core control. This often leads to improper posture, like collapsed backs or uneven hips, which not only reduces training effectiveness but can cause injury. The sitting pressure technique, when applied by a trained hand, can help align the pelvis and spine properly, minimizing compensatory movement and directing the stretch to the intended muscle groups. Moreover, this technique helps improve body awareness. During assisted compression, the trainee must tune into their physical sensations, monitoring stretch intensity, distinguishing between healthy discomfort and sharp pain, and synchronizing breath with the stretch. This kind of somatic awareness is vital for long-term flexibility progress and teaches the body to soften and yield into the stretch rather than resist it. Despite its usefulness, assisted waist compression is not a brute force method. It requires sensitivity, coordination, and a careful approach. One of the most critical elements is timing. The technique should only be introduced after a full warm-up session, ideally 10 to 15 minutes of aerobic activity such as jogging, skipping, or dynamic stretching. Without adequate muscle temperature and joint lubrication, the risk of tearing muscle fibers or triggering spasms increases significantly. Equally important is the expertise of the person applying the pressure. Not everyone is qualified to perform this technique safely. Effective compression relies on a deep understanding of human anatomy, proper force application, and an awareness of movement mechanics. A skilled coach knows how to modulate pressure based on the trainee's posture and reactions, and will use verbal cues to guide breathing and mental focus throughout the process. Incorrect positioning or overzealous force can cause serious injury. Open communication between the practitioner and the assistant is also essential. The person being stretched must be able to articulate what they're feeling at any point, especially if they experience sharp pain or abnormal joint sensations. Injuries often occur not because the pressure is inherently too strong, but because pain signals weren't communicated in time, leading to continued pressure past a safe threshold. The intensity of compression must be controlled and progressive. It is not a matter of applying the most pressure as quickly as possible. Instead, the approach should be gradual. Start with very light pressure, observe the body's response, and only increase force as the tissues begin to adapt. This is especially true for younger students whose musculoskeletal systems are still developing. Excessive force on immature joints and ligaments can have long-term consequences. Breathing plays a crucial role during assisted stretching. Practitioners should focus on deep inhalation and slow exhalation, as this helps calm the nervous system and encourages muscular relaxation. Conscious breathing not only minimizes pain perception but allows the body to let go and surrender to the stretch. Conversely, holding the breath due to pain can lead to muscle guarding and increase the risk of strain. Assisted waist compression is commonly used during training for deep back bends and fluid spine movements, especially in beginner dance students. By providing controlled pressure, it helps them better understand how to articulate the spine without collapsing or compensating, leading to cleaner lines and smoother transitions. It is also highly effective in deep bridge poses or hip-opening sequences. In cases where students have trouble lifting the chest or opening the shoulders, strategic pressure on the back and hips can help activate the posterior chain and create a fuller sense of extension. In hip flexibility work, compression aids in fully opening the pelvis, which is crucial for achieving clean front or side splits. Beyond flexibility development, assisted compression is occasionally used in rehabilitation contexts. When tight muscles or post-surgical stiffness limit mobility, gentle and precisely guided compression under the supervision of a trained therapist can help restore range of motion. However, this should only be done after confirming the safety of such intervention based on the individual's injury history. Despite its benefits, assisted waist compression carries inherent risks when improperly applied. These include lumbar disc injuries due to excessive pressure or poor alignment, muscle strains from overstretching unprepared tissues, and psychological aversion due to pain-induced fear, which can diminish training motivation. To prevent these issues, it is essential to practice under the supervision of professionals, avoid comparing one's flexibility to others, and always train within personal limits. Practitioners should stay mentally engaged during stretching, listening to the body's signals. Post-session recovery techniques, like gentle tapping on the muscles or applying heat, are also recommended to help the tissues relax and reduce soreness. Used wisely and respectfully, assisted waist compression can be a powerful tool in flexibility training. But like all potent methods, it must be guided by knowledge, awareness, and care.